My first experience of having someone die was when I was an 18-year-old student nurse back in the 1970s. I was working on a male medical ward and it was my first ward. And I was really frightened at the thought of seeing someone die. I didn't know how I would feel or whether I'd be able to cope with it or not. And there was an older nurse working with me on the ward, a very wise lady. And I confided in her. I said, I'm really nervous. And she said, don't worry, the next time someone dies, I will come with you and we will look after them together and you can help me do whatever needs to be done and I'll be with you all the time and talk you through the process. And that was exactly what happened. A patient died and this lovely nurse took me in with her and we stood and looked at the gentleman. She said some things to me that I've never ever forgotten. She said, just remember that what we're going to do now is the last thing on earth that we can do for our patient. We're going to prepare them and make them comfortable for their final journey. And that is an honour and a privilege. And then she said, just remember, he's never hurt you in life. He's not going to hurt you in death. And that stayed with me ever since. And I've always remembered that. And the other thing this nurse taught me was about treating people with dignity. Because he may have died, but he was still there, he was still a person. So I always talk to patients after they've died. When I'm making them comfortable and preparing them, I like to talk to them and tell them what I'm doing. And I remember that, yes, this is someone's father or mother, this is someone's loved one, and I treat them in the way that I would like to be treated, and in the way that I would like my loved ones to be treated. It is hard. But it is so, so rewarding and it is a huge privilege. It's an honour to look after people. It's an honour to take them through their final few days and do all you can for them. And that's why I'm still nursing after 40 years. That's why I would never do anything else. And we encourage our end-of-life patients to talk about death and dying and about the type of care that they want and where they want to be. But most importantly, we try and get them to communicate that to their families, to tell their families what their decisions and their wishes are while they're still able to do so. You don't have to be old or ill or even dying to make a plan and to tell people what you would like, where you want to have your care, what sort of funeral you want. Anybody can do that at any time.